on to the next item, Steve.
Thank you, Mayor, members of council. The last item on our agenda is a presentation from Lee Health regarding COVID. We thought this was particularly timely because there's a lot of good news happening in the community, and we don't want to diminish that, but it's also a time where we want to remain vigilant. And Lee Health has a person here who, in government relations, Michael Nasif, who is monitoring this process very closely and has some great information for us. So I'd like to introduce Michael and thank him for coming on behalf of the entire community.
Thank you very much, Mr. Mayor, Madam Vice Mayor, council members, and village staff, and of course, the citizens of the village of Estero. I appreciate very much the opportunity to be here today and speak with you all and present this information. Mr. Mayor, as you said, this presents an opportunity for us to continue education in and around COVID-19, and we are experiencing a number of positive trends, and we certainly want to celebrate that good news, but continue to remind everyone in this process to remain vigilant and continue to protect each other. I'd like to start with, can I move the PowerPoint here, I expect? There we go, thank you. So I'd like to start with an epidemiology update just regarding the amount of cases and deaths across the United States and bring it a little bit more local. So in the United States, we've experienced, starting on a global level, we've experienced 112 million cases of COVID-19 and 2.49 million global deaths recorded. In the United States, it's 28.2 million cases with 500,000 deaths. In the state of Florida, it's 1.9 million cases with 30,595 deaths recorded. The positivity rate in the state of Florida as of yesterday was 6.82%. which is below the 10% threshold, which is a good thing. In Lee County, we've seen a total of 56,787 positive cases and 865 deaths recorded in the county. For Lee Health specifically, we've run a total of 80,788 tests since March of 2020. 14,666 of those have been positive. 66,212 had been negative. That's an 18.1% overall conversion rate. In the last 4 weeks, our daily conversion rate has been down significantly, which is a very positive trend. It's been some days below 10%, some days a little bit higher than 10%, but understanding that Lee Health is only testing symptomatic individuals, you still need to get a prescription from a doctor for us to test you. So when our test rate is in the 10% range, that's good news when you're seeing that coming out of the hospital. We've experienced, of the 800 some odd deaths I told you for Lee County, 587 have been at Lee Health. That's expected because we're the largest provider by far in the county, and so you would expect that to happen. Lee Health is currently treating 84 COVID-19 positive patients in our hospitals compared to 203 on January 9th. When we experienced our peak in mid-July, we had roughly 360 COVID-positive inpatients. So we're seeing a very nice downward trend in that regard, and we're very happy to see it. I wanted to touch on the governor's executive order on December 23rd and explicitly who it instructed providers to vaccinate. So when the governor's order first came out, the tier 1 of individuals who could be vaccinated were long-term care facility residents and staff, persons 65 years of age or older, healthcare personnel with direct patient contact, and there was a brief caveat at the end that said hospital providers could also vaccinate persons who they deemed to be extremely vulnerable to COVID-19. What that meant is that hospital providers and medical providers generally, as it was later interpreted, could vaccinate individuals that were under age 65 that had pre-described conditions that made them more highly susceptible to COVID-19, things like liver disease or type 1 diabetes or cancer or those things that you know that gave them autoimmune deficiency conditions. And so there was a period of time when the state of Florida for a number of weeks wasn't receiving enough vaccines from the federal supply chain to be able to give vaccines to hospitals so we could vaccinate those populations. But as of 4 weeks ago, that started ramping up again. Lee Health has been receiving roughly 1,000 doses a week that we have been delivering to that population of under 65 with those conditions. as well as some 65 and older who have been we've deemed as extremely vulnerable that are in patient populations, and we have their electronic health records, so we've been able to contact them directly, and some medical personnel. Yesterday, the governor marked a significant change in the vaccine strategy when he announced that we're going to start vaccinating teachers, law enforcement officers, and firefighters age 50 and older. So we don't have the details for those distribution mechanisms yet. He announced it yesterday in Hialeah. I saw the news conference live. I know there are a number of what we would call critical individuals that are going to be very excited for this opportunity. And as we continue the rollout vaccines and open them up to more people, keep in mind the goal is to vaccinate as many individuals as possible. So this is great news. So in terms of vaccine administration, overall, 63 million doses have been administered in the United States as of yesterday out of 75.1 million doses that have been distributed. Almost 19.5 million people have received 2 doses. In Florida, 4.4 million doses have been administered. 1.5 million have received second doses. Just putting that in perspective, Florida right now is ranking between 12th and 15th in the nation for percent of the population that's vaccinated, with the front runners being in the 10 to 11% range and Florida being just under 7%. That's important to note because most large states are lagging a little bit behind that. So Florida's actually done a very good job, and particularly as of late, in terms of getting the vaccines out. And as is noted by the governor's priorities, 76% of everyone vaccinated in Florida has been over the age of 65. So that population was prioritized. And as I mentioned in an earlier slide of the governor's executive order, nursing homes and assisted living facilities, that population was the first to be completed in the state of Florida. So really we've made a lot of strides there. And you'll notice that as we're experiencing declines in transmission rate and frankly death rates in the state and across the country, it's a healthy combination of vaccine administration increasing and of mitigation efforts continuing to make strides there. Internationally, Israel leads the way with 50% of their population having been vaccinated. Johnson & Johnson is promising to deliver 20 million COVID-19 doses to the United States by the end of March and meet their 100 million dose promise by the end of July, pending FDA approval. Early this morning, the FDA put out some information ahead of their independent review panel tomorrow that they see Johnson & Johnson as an additional safe alternative and that they are likely to approve it. So I'm expecting by the end of this month, here we are on the 24th, by the end of this month, they will probably receive their emergency use authorization approval. Roughly 300,000 doses are being administered currently in Florida weekly. And just to visualize what I explained there, I wanted to be able to provide a graphic or two on this point. So in late December, early January, the United States was administering under 400,000 doses a day. As of today, we're averaging across the nation administering over 1.5 million doses a day. So we're really making strides on that front, and as long as the supply chain continues to ramp up, I believe we do have the mechanisms in place to continue to ramp up large-scale administration of vaccines. And just one more graphic to demonstrate where I mentioned Florida is in terms of position of other states. As it relates to this graph, what you'll see is that the darker the shade of pink of the states that are referenced, the better off you are. And so you'll see Florida there towards the bottom of the graph in a pretty strong position comparatively. So vaccine information. Pfizer vaccine is 52% effective after 1 dose. Moderna is 94% effective after 1 dose. Both are more than 95% effective after a second dose and after 2 weeks. So just to be clear on that it's a different type of messenger RNA that delivers them. So that's why you'll notice after 1 shot, Pfizer isn't quite as effective, but after 2, they are both the same level of effective. Immunity from vaccine lasts at least 3 months by current studies. The only reason we know at least 3 months is because we don't have longer term studies. This process has, it's just come out. We don't have a lot of data that goes past that. Our expectation is it will last much longer, but until we have concrete data, it's difficult to assert that. So at this point, we're showing that we have one study that has a 5-month post-vaccine demonstrating antibodies, which is a good sign, but it's not a definitive sign of protection. Testing for antibodies after the vaccine is not recommended just because it's not a definitive sign of whether or not you are protected. Do not take things like aspirin or ibuprofen before you get a vaccine, but we recommend that if you need it for pain after receiving the vaccine, it's safe to do it and it won't impact the efficacy of the shot. When it comes to the mitigation efforts, we need to achieve roughly 60 to 80% of an immunity across the population before we would suggest limiting mitigation efforts. Now, we know this is never going to be perfect, and we're making great strides right now, and you all experience in your day-to-day lives that some people are taking stronger efforts than others. Our suggestion is to keep taking those strong mitigation efforts of wearing a mask, distancing when you can, avoiding large crowds, and hand washing until we can get that broader immunity across the population. Even with more than 30 million doses of the vaccine delivered in the United States as of today, that's still only roughly 10% of the population, or a little bit less, that has been immunized. In discussing the variants, right now the most prevalent variant in the United States is originally known as the UK variant, or B.1.1.7. There are 1,661 cases in 44 states. There's no evidence to suggest an increased severity, and the vaccine does seem to work against that variant. There has been talk at the federal level from the CDC, and Dr. Fauci has said that this is likely to become the most prevalent variant in the world just based on transmissibility, but that it will not have a more impact in terms of severity. The B.1.351 first seen in South Africa, there are 22 cases in 10 U.S. states as of yesterday. No evidence to suggest that there is increased disease severity. One of the mutations may affect monoclonal and polyclonal antibody response, possibly less responsive to the vaccine and antibody treatments. So we're going to be monitoring that closely along with our peers across the United States, particularly relating the treatment of those who have to be hospitalized. And then the P1, which is the Brazil variant, there are 5 cases in 4 U.S. states. Not as much is known at this time, but evidence is still suggesting easier transmissibility of that one, like the UK variant, and perhaps lower protection from the natural infection. So we're going to be monitoring these variants closely, and obviously, as a whole, the United States is going to be keeping a close eye on these. So the conclusion to this information is, and I had mentioned before, is we're seeking to achieve that immunity of 60 to 80% of the population before relaxing mitigation efforts. We want to make sure that the folks in this room are doing a great job, and we continue to emphasize with our residents here in Southwest Florida that we've made great strides. We can't lose ground. We want to keep moving forward as we continue to get everyone vaccinated. It's important to note that being vaccinated does not mean that you can't get COVID-19. It just gives you a 95% chance of not having a severe reaction to it, meaning there's still a 5% chance that you could, but aside from that fact, it also means that you could have you could still get COVID-19 and give it to someone else and never know you had it. You could have an asymptomatic transmission of COVID-19 after you've been vaccinated. That's important to note. The easiest way I can explain that is imagine the way the average young person responds to COVID-19 right now. They could get it, never know they had it, and give it to someone else. Once a more susceptible population individual, 65 and older or immune compromised, gets the vaccine, they have to imagine themselves as being in that population, that you could still get it and give it to someone else who is not yet immune to COVID-19. That's why masking and hand washing are still so important. We can only act on the credible information we have at any given point in time, and we have to continue to protect each other as much as possible with those mitigation efforts. We want to keep Florida open. We want to keep Southwest Florida open. Those are the goals for all of us. That is the information we have, and I'm happy to answer any questions you all may have.
Any questions for council? Thank you very much, Michael, for coming and for giving us this information. I was taking some notes on some, as you were talking. You mentioned that the governor's order now will start allowing dosages to be given to certain classes of people under 50. Obviously, that's going to have an effect of those 65 and over who have not gotten it yet, and there's still a lot of those. Do you have any idea whether it's, you know, the number of vaccinations for the people over 65 will be diminished for it, or are we going to get that many more vaccines that they're anticipating that they'll still be able to continue at the rate or increase the rate for those over 65?
So to be clear, the governor's original executive order allowed hospitals to vaccinate individuals that were under 65 that had the qualifying conditions that made them susceptible to COVID-19. The governor has stressed that it is still the state of Florida's priority to vaccinate individuals 65 and older. What he announced yesterday was allowing individuals, teachers, law enforcement, firefighters, and additional first responders who are 50 and older to be included in that next group and be vaccinated. I don't believe it will have an impact on the supply for 65 and older because the governor's announcement included that he would be using the additional vaccines being received by the 3 federal sites opened in Florida to allow for that to not impact where the current 300,000+ doses a week are going. So there are 3 federal sites that were opened in the state as of late last week, and the governor announced that he's going to be utilizing that impact to allow for vaccinating this additional population without limiting the 65 and older.
One of the things that you mentioned earlier, that we need to get 60 to 80% of the population vaccinated or have gotten the disease to get herd immunity. What do we do, or what do you think we're going to do, or is anything being done, that we have people who are just not going to get vaccinated? There's a lot of people, and I think part of the problem is there's a certain segment of our population who are in very critical positions, who are in the medical field, that are electing not to be vaccinated, and yet we're coming in contact with them every day. The same with teachers and policemen. How can we say that we're going to get to an 80% number, knowing that so many people are just not going to do this?
So in controlling the situation we can in front of us, we're going to continue to ramp up education as much as humanly possible and help folks understand the potential benefit of being vaccinated and what it means for the whole. You know, there will always be those who will refute or refuse a vaccination. That's been true of every vaccine that has been offered in the last century. But as it relates to trying to combat this in an effective manner, the best we can do is, one, we still have more demand than supply, right? So we have to continue to ramp up supply and vaccinate everyone that wants to be vaccinated. And while we're doing that, we have to turn efforts to educating those who aren't quite ready to get there and help them understand why it's so important for not just them, but for those around them and their family members in getting to where we want to be, which is past where we are now with mitigation efforts.
I just have one more question. You mentioned that current testing has shown that the vaccine, after you've gone through the full protocol, is effective for at least 3 months. There's some testing that's not yet been conclusive or enough of it to show 5 months. How do we, after we've taken our vaccine, how do we know that we're still covered? I mean, if we get out 3 months, 5 months, 7 months, are we going to have to rely on new testing results to tell us? And at which point, is there going to be a point that we're going to have to get a booster to keep this immunity intact?
Like many other historical vaccines, a booster could be a likely result down the road, there's no doubt. But at this point in time, that's why the mitigation efforts remain important and why we're trying to achieve that the herd immunity as soon as possible, of that between 60 and 80%, and making sure that we're protecting people in the meantime. The most vulnerable populations in this state have, when we talked about the amount of folks who have been vaccinated in Florida, roughly almost half now of everyone 65 and older has been vaccinated in this state that's a full-time resident. Obviously, we need to continue to step that up and go quicker, and that though that's important in terms of protecting the most vulnerable population, it still doesn't achieve herd immunity, so we need to keep ramping up efforts to vaccinate everyone else. And in that effort, we ask that folks continue mitigating, continue protecting each other, and we'll do what we can as medical providers and to help the state in their distribution efforts.
Thank you very much.
Howard, just to follow up on what Nick asked you, I understand that you can't force your staff to take the vaccinations. What I don't understand, though, is why that isn't disclosed to the people that are going in for treatment. At least the patients should have the choice. If they knew that their provider, who's going to be right next to them, refuses or is elected not to be vaccinated, that they will know that, and then they can make their own risk assessment, because, in all actuality, we have to protect ourselves, and we can't rely on others to protect us. I recently went twice to the Coconut Point Hospital for a wellness check, and in each case asked the provider, who was right next to me doing whatever they do, whether or not they had the vaccination, and the answer was, it's a personal choice. It's a personal choice, so I obviously knew that they had elected not to. I wish I had known that before I went in. I would not have gone in. I think that's where you missed the boat. I think you need to explain that to the patients and let them make the choice as to whether it's within their risk.
John?
Thank you for coming down and getting us the update that you've given us. Do you have any data at all as to Pfizer or Moderna, what percent of the shots that were, or the vaccines that we're giving are one or the other?
I'm sorry, I don't have a direct for the state of Florida. I know at this point that Moderna is the most prevalent, being utilized across the state, and that just simply has to do with the ultra-cold storage requirements for Pfizer. So initially, we had the Pfizer 5 hospitals in the major metropolitan areas. Those were the first vaccines that were received in Florida. When we received our second large allotment of doses in late December, those went across the state, and many hospitals were able to receive them. But as of right now, county departments of health, the retail pharmacies like Publix, they're only distributing Moderna because of their ability to not ultra-cold store.
What's the temperature requirement for Moderna versus the other ones, 90 below zero or something?
So there's been a number of reports on this, and including recently where they think it may require less ultra-cold storage, but I think the level of agreement for Pfizer has been roughly between -60 and -80 degrees. There's some recent data that suggests we may be able to not have to go that cold. Hopefully that will prove true. Moderna is more of just a regular freezer, like a -4 to -10.
Okay, any other questions? Okay, since we've been doing this for 6 years, I think we keep coming up with better ways of having guests come in here. But I want to make a suggestion today, because I had some of this stuff happening in another board that I chair here in the community, and when we have guests, and we have somebody has their name on the agenda, we know what the topic's going to be. If we have questions for them, we should send the questions to our manager, and the manager can forward the questions to our guests. So we don't put these people on the spot when they're here. You probably feel like you're on trial here, some of these questions that you were given. I know the news media is pretty tough on this. Every night we hear this for an hour and a half on our local news, the national news, and I kind of feel for you today, because this is everyone's hot button, and we certainly didn't mean to put you on the spot with some of the comments. But some of the comments that are being made are reality, but I think it's better if we can give you those questions ahead of time, using you as an example moving forward as a council, so that when a guest comes here, they're prepared, you know, for some of these questions that they're pretty tough to answer on your feet. If I was in your shoes, I wouldn't be too happy right now. But anyway, anyone sign up for the public to speak?
No, Mayor.
I really appreciate you coming today, sharing the information. I don't envy the job that you have right now because it is a tight wire that you're walking. We have a conference call with the county each and every day at 2 o'clock. And it's like in Kentucky Windage. One day we're getting the vaccines. Oh, there's a problem. We have a weather situation. Last week we were down to 1,800. This week we have 8,200. Now there's a difference in what days they're going to give the first shot and the second shot. So this equation keeps moving right along. So we try to manage through this as best we can, and I applaud your efforts here today and putting up with some of our questions.
Thank you,
Anything
Mr.
else for us?
Not for this item. For the 10A, I have another e-comment.
Okay, you have a question, you have a comment from another topic?
Yeah, for 10A.
Okay, all right, thank you, Michael, I appreciate it.
Thank you.
Thank you.